Nurses are leaving the profession because they're frustrated, they're tired. You can work for insurance companies, medical device sales. There are a lot of different things that we can use our skill sets.
What is it about the pandemic that's really putting a lot of the stress on the nurses?
The difference between this wave, we are doing surgeries. We now have patients who are suffering from long COVID that need hospitalizations. These patients are coming into the hospital much sicker. We have a vaccine that could really help curb off this pandemic and move us in a different direction. They feel dumped on to some degree.
What is that appropriate ratio?
It's not a one size fits all. The acuity of the patient really plays a heavy role. So you have nurses who work in a critical care unit or even in just a general medical unit that have a special defined set of skills. Critical care nurses are taking care of the sickest of the sick. And those patients normally have multiple IVs with very high-risk drugs that they're infusing into their patients. These patients are intubated sometimes, and so that requires a special level of care and monitoring, just in order to maintain skin integrity and that sort of thing. These patients have to be turned every so often. The amount of care that is required in our critical care areas really necessitates that those nurses only take no more than 2 patients. And a lot of times they really just need to focus on one patient due to the amount of care that's required. When you're trying to take care of everyone that walks through the door, that can be very, very difficult. Our nurses are stretched very, very thin, which means there potentially will be a delay in someone even being available to help you go to the bathroom, much less bringing you your medications that you need. As our hospital beds, are full, that might also mean that you're laying on a stretcher in the ER for hours or maybe even days waiting for a bed. This isn't the standard that they want to live up to, but it's what they've been handed. It's important for the public to know that.